Hi everyone, my name's Augie Rodriguez. I am the board president here at BQAC, and in this episode of Evening Brew, we present our academic partner, Dr. Lauren Beach of the ReACH Lab and Advocate from Northwestern University. We are going to have our host, Hugo Escobar, introduce Lauren in the episode. And Lauren, they are going to talk about the history of BITE, or Bisexual Inclusive Therapy Education. Mental health has been very important to our community, and we want to utilize this program as a direct service. We've taken the last 3 years to develop infrastructure, and we're looking for more funding in order to bring this to life and as a resource to our community. So, if you're looking to get involved either from being a community member here locally in Chicago, or you want to help us fund this initiative, definitely reach out to us at info@bquacchicago.org, and I hope you're going to enjoy what you're about to see and what we've been doing to help our community out. Enjoy this.
Welcome everyone to the Evening Brew. We have guest this evening is Lauren Beach, well recognized for her research work at Northwestern University. Also, board advisory member for BQAC for so many years. Dr. Lauren Beach has spent a certain amount of her years, working for the bi-queer community population, doing research, coming up with new statistics. So it will be very, very important for us to get a little educated where we are as a bi-queer community in the spectrum of statistics and research. Welcome to the program. And can you introduce yourself? Thank you.
Thank you so much, Hugo and Augie, for the invitation to be here with you tonight for Evening Brew, which I think is just a fantastic program. And I do love the introductions of knowing everybody who's here in the space, because I would love to have a conversation. I know we have until 9 p.m. for this, and I have a slide deck, but I think that the power of the work here is that it's all the stories coming together. Because when I think about research, the main impact of research is that we're collecting the voices from people, in this case, in bi plus and queer communities, to really understand the needs of people in terms of mental health, is what BITE, which stands for Bisexual Inclusive Therapy Education, is about. And I don't like there to be such a separation that I think is often thought of with like research and statistics. People don't realize that every row of data in a data set is someone's life. And I think programs like these really bridge that gap and make it really clear that bi plus people matter, and that our experiences are unique. Not everyone who's bi plus or queer has the same experience, but I think hopefully that and more comes through in the conversation as we think about really the impact of BITE is improving mental health care for bi plus and queer people across a variety of backgrounds. And so how do I come to this? How do I relate to this as a area of work? So I myself identify as bisexual. I've been out as bisexual since 1998. So that's 27 years, if you're counting. I just did the math, pull up my little calculator. Oh, it's been 27 years now. But I came out as a freshman in high school in a suburb of Detroit, Michigan, and didn't really find a lot of support in my high school, as it were, at the time, and didn't really come out to my family until years later when I was an undergraduate at Michigan State University, where I started doing LGBTQ student activism work, including within like the student government, and like eventually becoming president of the political advocacy group on campus. Well, that's awesome. So I love that connection that we were both in Detroit in 1988. That's awesome. St. Clair Shores was the high school that I went to, Lakeview High School, if it matters. But at Michigan State, I got really involved in student activism, and I felt like I was like one of the only bisexual people I knew, because I got a lot of pushback from gay and lesbian and other queer identified people for saying I was bisexual. And it really wasn't until 2011 when by that point, I had moved to the Twin Cities, and I did go. I know there was at least one other Twin Cities person on this call. I did go to the University of Minnesota for my graduate and law school training and was there for about 7 years. Yeah, that's awesome. I saw you talking about transit. That was cool. Like they were just building the light rail when I was moving out of the Twin Cities in grad school. But why? So like at that point, I was in the Twin Cities and I joined the board of the Bisexual Organizing Project, which is like Bisexual Queer Alliance Chicago is another bisexual specific community organization, 501c3 charitable nonprofit that really the Bisexual Organizing Project runs the Because Conference or Bisexual Empowerment Conference, a uniting supportive experience that still goes on to this day. It's been going on since the 90s and it does a lot of similar work to BQAC. So it was really about, I tabled at 10 different Pride events per year in the summer for BOP. I traveled all over the upper Midwest. I also participated in 2010, 2011. I helped them lead the third needs assessment that BOP had actually done. They had done their first one in 1991, a second one in 2001, and a third one in 2010, 2011. I helped them work on that. And why do I mention those years and kind of the needs assessment? It's because it was the first time that also in that time period that the Williams Institute came out with, and the Williams Institute is like a policy think tank at the UCLA Law School out in California. Oh, yes. Yes, I do. I know both of them. Elise and Victor. Yeah. Just commenting on things popping up in the chat. I was chairperson of Bisexual Organizing Project eventually for about 5 years, something like that. I was also on the board of the Minnesota LGBT Campus Alliance, and I've been on 10 different nonprofit boards that are LGBTQ or HIV related since I think about 2008. But in terms of what was really seminal about kind of this time period, though, of when I was really active in the Twin Cities with Bisexual Organizing Project, is the Williams Institute came out with their report that showed that bisexual people comprised the majority of LGBTQIA plus people. And why do I mention that? It's because of how alone I felt prior to finding other bisexual people when I joined Bisexual Organizing Project in 2008 after going to a Because conference. And I thought, there's millions of us, and we're the majority of the LGBTQ community. And Williams Institute's reports was really seminal because it didn't just show that finding in one study at one point in time. It showed it in every single study that was done demographically that asked questions about sexual orientation, both identity and behavior. And also they found the same pattern by attraction, sexual attraction, romantic attraction, like these different questions that were in big surveys that not just in the United States, but also abroad, that they were finding this pattern that bi plus people were the queer majority everywhere. And I thought, what? Like there's this many people and there's people who do science and studies about this. And I could immediately see the power of this data to help inform the education, research, and advocacy work of Bisexual Organizing Project. And then I really switched the trajectory of my career because my PhD is in genetics and I did HIV basic science research as like a graduate student at the University of Minnesota. I was in the Institute for Molecular Virology, so very much not public health, not clinical research, right? And it was really my own identity and connection to the community that made me in 2015 really change the direction of my career trajectory. And I switched out of basic science and I went into LGBTQ health for my job as a scientist. I have also a law degree. And so you'll see on here bylaw, like I joined bylaw and presented at a number of legal conferences. I did my JD and PhD together at Minnesota. So I was in a joint degree program there. And my law degree is specialized in both kind of like tax law, because that's what you need to know about if you're going to help run nonprofits, unfortunately. And then I also specialized in health law and bioethics because I was very interested in thinking through what are the best and most ethical ways to do research that would impact the health and well-being. And obviously, you can see my focus now from coming to you to talk about BITE and mental health. Like I'm a public health and like medical clinical researcher, an assistant professor, and the tenure track at Northwestern University's Feinberg School of Medicine. And yes, I'm one of those people that had all my grants canceled and then reinstated. There's been there's just this roller coaster of the last year doing this work. But because I think it's who I am, the communities I've been part of and have been privileged at times to lead, like I will never give up. I can't. It's in my blood. It's my mission. And this is just one story today. that is about a partnership that over time I've been very proud to grow with Bisexual Queer Alliance Chicago, starting when Jesse Miller, if anyone remembers Jesse, was president of Bisexual Queer Alliance Chicago back in like the teens, and now persisting into post-pandemic and this new era, whatever we're in now, with Hugo and Augie. I'm very pleased to be not just collaborators for BQAC, but very close friends with in real life. Family, really chosen family in real life, I would say. And yeah, so why do I have the Campus Alliance on here too? It's because the Minnesota GLBTA Campus Alliance, which is now defunct, was an organization that created continuing medical education trainings to improve the healthcare of LGBTQI plus people. But really it went beyond that. We also did trainings at like Target or Best Buy, at AmeriCorps, at like just anywhere that needed a training for like, who are LGBTQIA people? What is sex, gender, sexual orientation? And a lot of the lessons I learned, I helped develop their very first, along with Becky Saltzman, Kim Jorgensen, and a few other folks at the time, a curriculum, their bisexual specific educational curriculum at Minnesota Campus Alliance. And that influenced a lot of the products that you're going to hear today that we built into the curriculum that has been now developed over 3 years of time in partnership with BQAC for the BITE project. So they also, in addition to just not just talking to healthcare teams, et cetera, they also made sure that they centered the voices and experience of people with the identity, with the lived experience. And they had what they called panels, therefore, in their trainings where people, you know, like in the Bi Plus training, it was like people who are bisexual, who are pansexual, who are queer, fluid, didn't use labels. They really were invited in the middle of this training about, like Hugo was talking about, with facts and statistics. They were really invited to tell who they were and what it was like to be a bisexual person. What is it like to be a queer person? And that was a very humanizing and important element, I think, of their training approach that I loved and also thought could fit well, therefore, into this BITE program. And I just want to give on a shout out to say, even though this organization is no longer active, it influenced a lot of what you're going to see today in terms of the actual approach for education. And I also wanted to shout out Dr. Alexine Toffey, who was a real mentor to me as well in creating the curriculum that we developed within the Campus Alliance. So yeah, hopefully that gives a context that this is not just something that I'm a scientist who does this research, but I'm a person who lives this life and I'm a part of this community and its history, including running multiple bisexual specific nonprofit organizations, community coalitions, and other sorts of action-oriented groups that seek to promote better health, wellness, and just systems change to improve the lives of people in these communities. So I've been at Northwestern. First, I was a postdoc, and I joined Northwestern in 2017 here in Chicago. And I founded not that long after actually in 2019 is when I became research faculty at Northwestern. And I'm actually housed in what used to be called the Institute for Sexual and Gender Minority Health and Wellbeing, or ISGEM for short. Now it got changed, the name of it got changed to Impact Institute in June of 2025. And so nonetheless, we still continue to do research that is really relevant for improving the health and lives of people across sex, sexual orientation, gender identity at the intersections of race, ethnicity, ability, language, and other factors that shape health, social determinants of health too. But prior to joining, you saw the advertisement today that said the Advocate Center. There was my lab that was named just ReACH, which was research on aging, chronic conditions, and health equity in sexual and gender minority populations. And you might have seen our logo if you've seen other events that ReACH has done to partner with BQAC. ReACH also, I have some of the awards that BQAC has given to ReACH the last couple of years up here in my office where I'm talking to you from tonight in Chicago. And then in 2022, Advocate got founded within ISGEM. And Advocate stands for Advancing Opportunities in Clinical and Translational Equity in SGM Health, or also known as the Advocate SGM Health Center. And we seek to translate research to practice, like thinking about clinical practice or, communities of practice broadly to policy change. So we seek to do research that actually is action oriented and can be applied to advance systems change within places like healthcare systems, but also the society at large. And we partner with BQAC in this action oriented framework for advocate. And we also we partner with a few other different organizations, coalitions that are also involved even in activities to like changing Illinois law to include things like SOGI data collection and privacy protections, or I think soon a long-term care Bill of Rights for LGBTQI people and people with HIV here in the state of Illinois. And we also have done work previously at the federal level, including with drafting policy briefs and other action-oriented change materials in the White House and the Department of Health and Human Services prior to 2025. That gives a sense, hopefully, of that advocate, ReACH, my own life. It's not just about science. It's about action. It's about equity. And it's about the need for justice because we can do better together, I think. So it's also co-led, co-designed. And how can we actually develop something like a research project or a public health program that could not just be something that's like, oh, we're going to publish a science paper in a peer-reviewed journal. Oh, we're going to publish a white paper and we're going to put it on BQAC's website, which we're also going to do, by the way, which is exciting. But can we help direct a program and make a curriculum that could be used to eventually cultivate something in BQAC like direct services to improve mental health access for the BIPOC people and queer people, et cetera, in communities who we know need this access. So before I jump into the program, I know, Augie, you said that this is being recorded, but if there's things people want to say in the chat, or if anyone does want to come off mute, if people have questions about the inspiration for developing the partnership we have, I'm happy to talk about that or any questions people might have.
Yes, please feel free to interact if you would like to, whether it's in chat or raise hand and we'll let you speak.
Yeah, most definitely. And thank you, Lauren, for this beautiful introduction. It led us to know you better, and also understand the policies, research, and so forth. So, yeah, if anybody has any questions, I know then it is sort of like Q&A. So in the end, also, there will be more questions after this presentation about BITE, as Lauren has explained it. It's in collaboration with BQAC. Now is your chance to jump in briefly and ask questions, comments. If no, leave it to the end. Let's continue then. Thank you, Lauren.
All right. Thank you, Hugo and Augie, for that. And I do have the chat open. When it went to record, it knocked my chat off. So now I can see it again just to keep better track. In terms of next, what I want to give is a sense of what is BITE. I've given some hints about some content you'll see coming, but like, what is it? How did BITE co-evolve to be a collaboration that is between my scientific lab and center at Northwestern and the whole team there that helps make that run, because nobody does anything alone, I think. And then also the LGBTQ health class that I'm fortunate to teach at the program in public health, which is the entity at Northwestern that actually gives out master's in public health degrees. And also a lot of medical students do dual MD, master's in public health training. And so that's kind of the group of people that help make this history a reality. So I know that Augie has put into the chat that BITE is short for Bisexual Inclusive Therapy Education. And it was also on the title slide of the talk today. And but yeah, so what is BITE? It is really, in short, a two-part educational curriculum. So a part that is created for therapists and other behavioral health professionals, talking to them about how to provide inclusive and affirming mental health care to BIPOC and queer people. And then also there is a section of this curriculum that is, like I talked about with the Campus Alliance, teaching BIPOC people, queer people, pansexual people, et cetera, how to tell their stories so that when this portion of like the training that is for continuing medical education credit is going on, that's filled with statistics and talk about health disparities and other higher level like scientific ideas, it can be grounded in the identities and stories and experiences of people who are in fact BIPOC identified. And so how did BITE get started? You might have noticed a lot of the science that I'm doing is really not mental health focused as the outcome, I do a lot of work that's more like aging and cancer, HIV, diabetes, heart disease. But what happened with why BITE needed to focus on mental health is it came out of you at BQAC. You said, and you talked about, and this has been true since I started collaborating with BQAC, I think in like 2018, that mental health has always risen to the top of the health concerns that people have brought to the organization, BQAC. And so it came up organically, I think, Hugo, as you like to say. It was a direct need from even, I think you said people at Bi Queer Movie Night started talking about mental health and the challenges of finding a therapist or other clinician to help manage mental health that came up from people from everywhere in the community. And we know that from many different sources that many people training to be like licensed clinical social workers or psychologists, psychiatrists, they do not get education about LGBTQIA healthcare, like how to provide good affirming care to these populations, let alone trainings that would be specific about how to provide this care to bisexual plus people, queer people. And we know that people don't have the same needs across the entire LGBTQIA plus community. There are many commonalities, but they're not identical. So specific trainings are needed. And this has come up too in some of the work I've seen where if there is like an inclusive directory of healthcare clinicians, people who are bi plus sometimes look at it and they're like, well, I can't tell just because this person sees like LGBT patients, do I know they're going to be affirming to me as a bisexual person? And a lot of people, some people feel okay with that and some don't. So BITE fills a need, specifically in this therapy and like psychiatrist, et cetera, space to help people find the healthcare they need by finding providers that have been trained. So that's the gap that we fill with BITE. So I talked about this. There's been a lot of work to really distill the values that BITE has behind it. So again, proving access to healthcare, affirming healthcare, empowering bisexual plus people to tell their stories to help it transform that healthcare experience through education, and then promoting continuous learning so that the existing workforce, as well as the workforces that are in school now, and undergoing training to get clinical licenses now, have the tools they need in terms of a curriculum led by and for the community to help them know how to provide that healthcare and make access to high quality healthcare easier. So I see more chat. Activities, so that's great. There's a couple different components. I've talked about this, the panels, and didactic just means like this, like I'm giving a presentation. Continuing medical education training were the two portions of what BITE was about, and the milestones for how BITE evolved and where are we at right now. That's what a lot of the rest of this story is about. So I want to mention that the first work that was done for BITE actually happened before the first grant was written. There was a study that I had conducted with Howard Brown Health and BQAC back in 2020, and it was called We're Here. I'll show you a paper that came out of that in a minute. And I was on how do we make primary care, like your primary care doc, like that you would go see for literally anything. How do we make primary care better and more affirming for bisexual plus people? And the thing that came out of that is people said for those who had a therapist, if they could access health, mental health care, not everyone could that we talked to in the study, but if they did, they said, why is my therapist not my primary care provider? Because I see them more than anyone else. I see them once a week. I see them twice a month. I would never go see like my primary care doc that much. It seems like mental health care is the most important health care for what is in my life right now. And they said, we just need more of that. Full stop. More work in mental health was also what came out of that study. And then in June, or actually I think in May or June of 2023, I started talking to Hugo and Augie and I said, hey, like I want to change the way I teach this LGBTQ health class. What would you think about having BQAC become like a community partner of the class, and the students in the class for their final projects for a grade that they could actually make work products for BQAC, and to receive an A or whatever they're going to get in the class, that they actually have to deliver their final papers, PowerPoint presentations, evaluation plan, whatever it was that they made. They actually have to put it into Google Drive and share it with you at BQAC. And thankfully you were willing to take a risk and say, yeah, what do I need to do? And so you two have come to my class every summer because this is a 10-week class. So it's on the quarter system at Northwestern that gets taught from June to August every year. And so you came in and started talking about BQAC and said, we really just need something to help people access affirming mental health care. That's just come up so much in prior work and in all of our Pride outreach and online programs, et cetera. This comes up all the time. So I had the students, I said, well, how about if we write you a grant to try to get funding to do something like this, like build a project like that, and came up with this idea of like an educational curriculum. And so then the rest is history. The students in the class actually drafted the first draft of the first grant that BITE ever had to get funding, and it was funded. So I took that initial draft that the class had made, and we shared it with Hugo and Augie. We discussed it, and then we submitted it to the Alliance for Research in Chicagoland Communities at Northwestern as a seed grant. And it was just an $8,000 grant, I think, but it was funded. And then that kicked off BITE, the first work of BITE. Following that funding, so we applied for it in the summer. It was funded in February of 2024. And then soon after, BQAC was named as an internship placement site for Masters in Public Health students at Northwestern. They call it APEX, or Applied Practice Experience, is what APEX stands for. And then you took your first ever student, Osayama, was your first student within that APEX program. And Osayama also was able to work on helping BQAC, who has no paid staff, as you might know right now, fulfill the grant deliverables for the art grant, along with my staff at ReACH Lab and the Advocate Center, as well as myself. Like, we all collectively worked on this initial grant, and the deliverables for that was to develop a toolkit to train BIPOC people to tell their stories, because I really thought starting with a storytelling approach is very powerful, because it starts in that human lived experience and it really outlines the needs people have for this care. And also, I think people can draw a lot from attending sessions a lot like this, actually, to just hear other people's experiences with trying to access healthcare, what it's like for them, talking about breaking the stigma about mental health, et cetera, and just sharing where people are at navigating trying to access care, if they've accessed it, or help each other, And then following this work in 2024 and the grant, we were able to host some community review sessions for that panelist training curriculum, and Hugo and Augie led those. And then we had more class deliverables I'll talk more about that were like actually developing, editing that curriculum based on the feedback from the grant sessions, and then developing the continuing medical education curriculum, and a lot more that I have more in detail. But yeah, I'm glad you remember Osayama, Augie. That's great. In terms of that article I mentioned, has anyone here heard of By Women Quarterly? Even if it's like raise your digital hand. Awesome. So I want to say that By Women Quarterly is a community publication that's been running since the 1990s, maybe earlier. Robin, if you ever watch this, don't kill me. So Robin Oakes, Ellen Ruthstrom, and many other really talented people in the Boston area who run Bisexual Resource Center, Resource Center at times, et cetera, run this publication. And so you can check it out. But we put the description. There's a feature in By Women Quarterly called the Research Corner. And so we wrote up a little description of that first study on primary care with Howard Brown Health. So you can check that out. We've also published scientific journal articles on some topics, some work that's come out of this work that I could give to people. I probably have to send it to you as PDFs though, because there's usually paywalls on the articles that are in like peer-reviewed scientific journals. But I can send those if people are interested. I talked about the grant already. This right here is Jay, who is the director of the Alliance for Research in Chicagoland Communities. If you also want to learn about what it takes to apply to one of these seed grants, or they have larger research grants, there is a link here. You'd have to partner with a Northwestern faculty member, like me, if you want to reach out, for example, or there's so many colleagues who do great work too. But, you can look that up on this link here. We talked about Osayama. And then this takes us into kind of the next couple years of the class. So how did we develop it? So coming into the summer of 2024, we of course had the funded grant, we had Osayama, we had a lot of work that was ongoing to produce the toolkit. We gotten feedback from the community. And so then the next thing that I knew was going to be needed to help us be competitive to apply for additional funding to continue to support this really important work was going to be like more documentation, basically. And so what I had the students in 2024 do was the group that worked for BQAC, they did a program manual and evaluation plan. And so I think this manual, like total, it was over 50 pages of beautifully formatted Canva report that talk about everything I just told you, but in written form, the history, the grant, the philosophy, what are some sample panelist questions? And then they even developed like surveys that people who are going to take like the continuing medical education program could say what they learned and, you know, give comments on the quality of the training and how they would change their clinical practice. They were very, very thoughtful. And the evaluation plan is really important for those who are like nerds on like me, who likes to think about like, how does this connect to like the next grant and stuff? Like having the ability to monitor and evaluate the impact and the learning effectiveness of the curriculum is really important to get to bring in dollars so that people on the scientific side can see how well can you measure these things and can other people reproduce the effects. Like if we evaluate the training and we say, oh, it was effective at helping therapists say they feel more confident and know how to better serve their BI+ patients and that they're providing therapy to. Like it's important that in the larger community that we prove we know how to do that and can give our materials freely is my philosophy to other people to be able to have the whole world go out and do this is the idea. Like make a big project. Can we get as many people as possible doing this to really change the landscape of what it's like, you know, no longer feeling fear or doubt or intimidation when you go to try to find a therapist and you know, like this person has taken a training that was led by and for the community and that, you know, that we found it's effective. Like that's what we really would want. And so this manual and evaluation plan gives some tools to do that. And it also helped these students complete their MPH degrees, right? Because they're taking the class by this point. It was still an elective. As of this coming year, this 2025, LGBTQ health is actually one of 3 required courses that the students in the public health program have to take if they want to graduate with their MPH degree for health equity. They call it the Health Equity Select. So it's kind of hit a lot of different birds with one stone, like helping people get this training in LGBTQ health that they often miss in medical school and public health training. It helped BQAC have more documentation to be more competitive, like building on the success of their first grant. And then it really helped with making us be able to move forward into developing the actual curriculum in the following year. And there are some slides here. I want to give credit that these slides that you see starting here come from the actual students. So the BITE program manual evaluation plan, like going into this slide, is now students who actually, these are from the final presentations that they shared. And of course, the other part of the class is Hugo and Augie come to the course and they watch the student presentations at the end. So they have all of these materials and can use them to do whatever BQAC would like to do with them. Students understand that as part of the assignment that they're delivering to the partner for improving the actual operations or deliverables of BQAC and it's to meet its mission. And so these are from there. So the students talk about, like they thought about not just putting together surveys to measure the impact of the training, but what is the theoretical framework that justifies this particular evaluation approach? Like how can we root this approach in liberation-based evaluation frameworks that are transformative, et cetera? They also really operationalized, building upon what Osayama had also described, I think, in part at this point. How are they going to describe the learning objectives and what are the components like to help teach panelists how to tell their stories? Like what are the different points that they're going to educate on going to be? They really wrote that out in this manual. And then we talked about the feedback sessions. And this is Hugo and Augie, if you have anything, because you led these and also mentored Osayama, and I was there with you, but you did a lot of this work. It wasn't just me. So I wanted to say if there's anything that you wanted to share about your experience with this, because it's our collective experience.
Yeah, I could briefly share. It was quite the daunting task logistically just to get community members to come and give us feedback on this training, specifically for training the panelists. We wanted their initial feedback so that we knew what language was missing. Was it inclusive or not? Was there something that they didn't relate to? Was it the font types that we were using for those who may or may not be visually impaired? Little details like that. And then after accumulating all this information and feedback and then giving it back to the lab to disseminate for further investigation, it allowed your summer 2025 students to do what they were able to do for us. Hugo, did you want to add anything else to that?
Yes, I will say it was a privilege being in the classes with your students, Lauren, at Northwestern. It was a totally privilege for us. Number one, because we are still an still growing organization. And just for my viewers this evening, then they are my cyber viewers for BQAC. You all know that you all had participated in many other programs through BQAC, and we do hear you. We do listen to you. And that's where all of this comes from. It's not all saying, let's do this program. This will be wonderful. All of you in Bi Queer Movie Night, in Men's Discussion Group, and all the rest of the programming, that's what you were expressing. Now you know the process. Then it took from go to point A to B, and we were messengers in your class, Lauren, and with your students, just advocating for our population, for the BQAC community, then, very faithful come to all these programmings. Amazing experience, and it's overwhelming to see it in practice, see it in this presentation this evening as well. Has been a lot of work, but thank you. Continue, Lauren. Thank you so much.
Thank you, Hugo and Augie. And this obviously could not happen without you and the history of all of the different work BQAC has done, like Jesse Miller, both of you, and then the class. And then I want to shout out Kevin Hasher, who is both a student in my class in 2023, who helped write the grant and then continues. Kevin is an MD MPH student. Kevin at Northwestern. Kevin continues to work on BITE to this very day, and other programs to support the outreach and efforts of BQAC. I think Kevin's come and tabled with you at times, isn't that right? And also Grace Avila and my team, who has really fostered a lot of important work and helped coordinate with Osayama and done other activities. Grace is a research project coordinator in my lab, and I know has even been to your house for dinner, Hugo and Augie. So there's been a lot of people that got us here in addition to the class. Grace, Kevin, many others in my team have showed up, turned out, and participated in ways that have helped make BITE what it is. And shout out to Jenny Holtz, too, who's been the TA for my class the last 3 years or 2 years. I've lost track of time. I'm over 40, y'all. Don't ask me to talk about dates. So how did I initially connect to BQAC? Because Jesse Miller used to be on the board of Bisexual Organizing Project. No, oh yeah, Jenny is awesome too. So Jill's question, how did I connect? So Bisexual Organizing Project is another 501c3 specific organization that's bisexual specific organization in the country. There used to be 10. The couple have shut, but a couple have started. And I did do a legal research project. The first one I did like this, I think was back in 2011, where I found I went to the IRS and I found every single 501c3 that did LGBTQ work in the country, and then narrowed down just to make sure I wasn't missing any bisexual specific organizations in the United States. And then I was doing a survey to see what the total gross annual receipts was. And that's where I found out it seemed like it was less than $100,000 for the entire bisexual movement for the entire United States, for example, back in that time frame. But I know very well, therefore, I know a lot of bisexual community leaders across the United States and then also in other countries across the world. And so that is my initial contact to BQAC, Jill, to answer that question. I myself have I helped with a couple people in Nashville, Tennessee. I helped fund Buy Plus Tennessee back when I was living in Vanderbilt. It feels like I was living at Vanderbilt when I was there, but working at Vanderbilt there, which was Tennessee's first bisexual specific nonprofit. I've done a lot of different types of community work, and I came to this work in science as a bisexual person in the community first, Jill. So my heart will never waver from it. And then Jenny is an amazing person too, who really helped make the class what it is and engaged with BQAC too. But yeah, so the panelist toolkit, yeah, of course you get this AMA, ask me, or AM, I don't know, ask me anything. Is that what it is? But let's see, panelist toolkit. So we talked about this, and I really I've loved everything about this. And this year, the class actually had 2 BQAC groups. And actually, there was another group in the 2024 class too that was doing a dissemination toolkit. So there's like a press kit if and when BQAC wants to do more to announce BITE. Like you have like a branding kit, you have social media assets. Like the 2024 class did an amazing job putting that together. It's just that until BITE is probably more ready to attract people who want to take the training or come see a panel, that's probably the time in which that 2024 dissemination toolkit could go into action for you at BQAC. But you still have it because it's shared with you on the Google Drive. But in 2025, it really brought the curriculum to life. And part of why we probably should have done the evaluation after, or vice versa, for what it turned out worked best for what you needed at the time, Hugo and Augie and Greg and Eve and others who I know are on the BQAC board. But we did it this way because we thought that we had applied for another grant to do the curriculum development work that we thought we were going to get, but we didn't. So the class came to the rescue again in 2025 and actually went back and really refined the panelist training materials and created the first draft of the continuing medical education materials. And so again, full shout out to the students from the 2025 LGBTQ health class that these are slides that they developed. And so they come out of the training to train panelists. There's also on top of the training to train panelists, that's if you're, I'm going to be a panelist, I want to be trained, you go sit down, you get this training. There's also another version of this training called Train the Trainer. And that curriculum trains people like Hugo, Augie, or maybe yourself. Maybe you want to be a trainer for the program to help train the people that are going to go train panelists. It's very confusing, maybe, how to give this training. So it's meant to do that, though, to keep program running, no matter if there's leadership changeover at BQAC. There's all the documentation and resources at the ready to help anyone step in. And then they have it written down. They have a recorded training. The students actually recorded their trainings, too, from the class, so that you have those as resources at BQAC to go back, and anyone comes in and learns what to do is also the intention of what the class has produced. And so here's some of these training slides. They have lots of pictures. People are creative. I am not creative. I don't make pretty slides. This one, so you can see I was no more than 8 lines of text on a PowerPoint slide, and try to make, actually have very few text slides, but you're just seeing some different content that they have. And I'm not going to give this training. I just want to give you some examples of what the students produced with this. And one thing I really want to highlight is that there was a lot of content in these trainings for panelists and teaching, Train the Trainer for panelists, how to understand the natural arc of storytelling. And so they talk about the beginning, middle, and the end, and what are the main impacts that you want to land, and how emotion is a really important part of understanding your storytelling's impact that will stick with your audience. And so that's really where they were giving examples. And then they talked about not just verbal, but also nonverbal. They even had tips too. It says making eye contact. If you're someone like me who's also neurodivergent, sometimes eye contact can be difficult. So they talk about what to do, ways to, in terms of how people would be presenting and sharing. And then these, I do want to stop on a little bit, for example, panel questions. And so the students made these with BQAC. How is it have you ever tried to find a therapist? You can see as the first one. And what advice would you give? How would you know, basically, that you've had an affirming visit? And these were actually put into a script that was recorded by the panelist group. And they, have both the actual written script and then the video that was handed over to BQAC. But yeah, Anything you'd want to jump in with, Hugo?
Yeah, I just wanted to say to our audience this evening, then all this work, as you can see, intensive communication in between Lawrence students and BQAC that we have participated through the 2025. And I always said, to have a good thing, it takes time. So you hear about by program in 2024 and 2023. We didn't talk too much about in 2025, but the work continued going.
Yes.
And the storytelling, as we speak, we continue tailoring at the storyteller, because I do know that our audience has been a lot in cyber, basically communications. We are trying to adapt that as well. And also, I would like to say that any of you can participate on this one. We are ready to deliver it, if you want to tell your storytelling. And that's something we will talk more about in 2026. The BQAC is preparing, all the board of directors are preparing. This is the first direct services. Then BQAC is focusing in providing, hopefully by 2026. So you will be informed in what's happening with BQAC, with Northwestern and Research Lab, with Lauren. So this is an ongoing process, Lauren, and this presentation is wonderful. We've seen it before. Please, I told you from the very beginning, it's going to be a lot of statistics, research. I prepare you, but it's all good. It's all good.
Yeah, absolutely. I feel free. I'm on LinkedIn too. You can find me there. My website is very out of date. I need to go and update it, but I'm active on LinkedIn. So you get a sense now of the panelists' materials. There's the script. What did the students make? They made a script. They made a video of them role playing the script. They made the storytelling guide as a separate PDF, handout. They made training for panelists, and then they made a training to train panelists. And that was what one group in my class did in 2025. And so we just were going through some of those. I also have shared these slides, and feel free to make them available. Hugo and Augie's, anyone who wants to see them, and totally exciting to share. No problem with that. The second group in my class this summer actually made a draft of the continuing medical education training, the didactic curriculum. Yeah, happy to share, Jill. It's nice. We can just share the folder of the output that the students made this summer. But the second group actually made the didactic curriculum. And so they had a nice slide that they put that I thought was nice to give. I think I make all the students start off their presentations by rooting it in the partnership and what is the class doing? What did the previous classes do? And I liked this particular formulation of how they shared what I'm trying to talk to you about right now. And the learning objectives for the training. Let's see one more thing in the chat. The learning objectives in the training, though, were really focused on building a common language and helping people understand how different patients might come to them. This person uses bisexual. This person uses pansexual. This person uses queer. This person says, I'm fluid. I don't really use labels, though. How do people, and another person might say, I use bi, queer, and pan. There's a lot of variation that people have. And so, understanding what these different terms mean and just starting off with a vocabulary, also educating them on gender in terms of what non-binary. I'm non-binary myself, too. I'm also asexual identified, and I've been out as ace for 10 years, non-binary for maybe 5. So teaching about the terminology that relates to neurodivergence, that relates to ability, also how different terms vary and conceptualizations of sex and gender vary across different sociocultural contexts was part of their training in this. And we talked about intersectionality, which is a core rooting value and principle of the entire LGBTQ health class. And so we talk about that at the beginning. The second module really is talking about who bisexual plus people are. Most of the data and demographic information, statistics, is focused, is on the U.S. context, but there are some studies that are not just within the U.S. Talking about global demographics of who bi plus people are, and how also distributions, thinking about social determinants of health, poverty, incarceration, healthcare access or lack thereof, health insurance status, employment, discrimination. There's a lot of things of that nature that comes into this portion of the training. There's also sections in this training that talk about what I call resilience promoting factors. So community connection and identity affirmation and the systems change work at the structural level that I was talking about with like changing law and policy at different levels in different institutions, et cetera, is part of this and like what that means. And so there's a framework that I published with Casey Xavier Hall back in 2020 as part of the We're Here project that's called Bias Forests. So it talks about like that framework of community empowerment and systems change rooted in social justice, intersectionality, et cetera, decolonialist philosophies to understand the health and health disparities and resilience of who BIPOC people are. And then we have a section that's really talking about like qualitative feedback that BIPOC people have brought through different research studies, through work with BQAC and other sources about like, what is it like to try to access healthcare? And like, this is usually the point in the CME training where we would pause and have a panel. So this is where like the panelist portion of this project becomes part of the continuing medical education training to humanize it and give people like real world content in terms of stories that I think people tell me consistently they take. Sometimes it might be like, what? I didn't realize that bisexuals were the queer majority. And then they'll also say, and I remembered so-and-so's story and what they said that really stuck with me. So like that's where this would go. And then we give tailored advice to clinicians about what they personally can do to promote BIPOC health equity, not only in terms of the direct patient care and like how to provide affirming patient care, which we do talk about. I want to be clear, though, that this training is not teaching therapists clinical skills. It is more about the population and how to provide affirming care to the population. Nonetheless, though, we do have some tips for that. And then we also have tips for how people can get involved in advocacy and education efforts within their clinical profession, their professional societies, different advocacy outlets, and ways that they can support BQAC, even give back, help develop the next iteration of the BITE curriculum, et cetera, is part of the training. And then as Hugo said, we're really talking about like now that we have this curriculum, we haven't gotten feedback yet on the CME curriculum, like from the community yet, like we did for the panelist trainings. But we did, we could do that. And I think we wanted to get feedback from therapists as well as from people in BQAC on the training itself. The actual, here we go, sit through the training and tell us how to improve it portion would come after this. And then we would want to be writing more grants, I think, to actually launch BQAC's ability to like deliver these trainings and then helping people navigate accessing behavioral health care in different ways. Especially the intention eventually would be like BQAC has like an affirming therapist directory. And the way that you would get like added to that would probably be you took this training that BQAC would then offer to people who are providing this care. And that's where we're at right now. More to come with next steps that to be concretized, operationalized. That's probably a real word in January this coming year. So that's where we're at with BITE.